Nurse Allen coming to you today from Healing Healthcare Training Institute here in the state of Michigan. Today I'm going to bring you another video from Headmasters TMU. Today I will be performing transferring a resident from bed to wheelchair using a gait belt. Now, I'm going to be doing this skill on a mannequin, but this skill is typically done on a live resident. So when you're doing this skill, sometimes it may be an intimate space, such as what I'm in today. So it's going to be a little tight in here, but we're going to make it work because when you're in the rehab center, this is what happens. But again, I just want you to know that this is a state testable skill. So I'm going to perform it on a mannequin, and it's going to look a little something like this. You're going to knock on the door. Good morning, Miss Allen. My name is Tanita. I'll be your CNA. I'm here to transfer you from your bed to your wheelchair using the gait belt. Is that okay? The patient is going to give me permission to do so, and at that time, I will do my hand hygiene until my hands are completely dry. I'm going to check the bed for safety, checking all the wheels, making sure everything is locked, make sure the bed is locked. I'm going to provide my patient privacy. So the next thing I'm going to go get is all of my supplies that I need for this skill. Now this skill calls for having a gait belt and non-skids for their feet or shoes. So I'm going to be using my non-skids to put on to perform this skill. Now, the first thing you're going to do is you're going to use a barrier. You always need a barrier on the table. So I'm going to just set my barrier here. This is my barrier to put my gait belt and my non-skids. So now I'm going to get Miss Allen up. I like to work smart, not hard. So the first thing I'm going to do is remove Miss Allen's call light. I've already checked the bed for safety. I'm going to move my wheelchair in a little closer so that we can use the wheelchair. Now in the scenario, it just says transfer the patient, but we do know that if the patient if it gave a scenario of a weak side, we will put the chair on their strong side based on what the scenario asks for. But you want to always make sure your chair is closest to you. So I'm going to let Miss Allen up in the bed. Miss Allen, I'm just going to let you up in the bed. I like to work smart, so I'm going to pull the chair in as close as I can to make it easy, and I'm going to pull her up in the bed as high as I can. So Miss Allen is sitting in an upward position. You just make sure your clothes are on correctly, Miss Allen, because we're going to get up. Okay, Miss Allen, I'm going to pull your clothes down and I'm going to pull your socks up. We're going to sit up in the chair, but I'm going to put your socks on. She already have on some, so I'm just going to change hers and put on some new ones. Okay, Miss Allen, I'm going to put you on some new non-skids. So I'm going to put you on a pair of non-skids. Making sure they're smooth on her skin. Now that I have Miss Allen's non-skids on, I'm going to turn Miss Allen around, let her dangle off the bed. Now, because she's a mannequin, we know she's not going to sit up very well on her own, but you want to make sure you have her sitting up at the side of the bed. I'm going to apply my gait belt around her. Miss Allen, I'm going to place this gait belt around your waist. So I'm going to place the gait belt around Miss Allen's waist. Now, depending on what kind of gait belt you have, some gait belts, they fasten like a seat belt. And this particular one, you have to feed it through the teeth. So I'm going to feed it through Miss Allen's teeth. So I'm going to feed it through the gait belt onto the teeth. holding on to Miss Allen because she's a little flimsy, so I'm going to hold on to her. And then I'm going to fold it through here, making sure I can put 2 to 3 fingers in between. I want to have a good grip on Miss Allen. And then the excess that I have left, I will tuck it in to have that out of the way so it won't be dangling or in the way where I might have a difficult transfer. So one of your skills is before you transfer your patient, you're going to have them to dangle off of the bed. So at this time, I have Miss Allen dangling off of the bed. I'm going to lower the bed down to the lowest position so that it's parallel with the chair, so that when I do the transfer, Miss Allen will be able to transfer and it won't be I'm not using any of my body weight. I'm just transferring her. So I would ask Miss Allen to put her hands around my waist. So I'd have Miss Allen put her hands around my waist like so. And then we're going to stand up. So the first part of this skill, I would have Miss Allen standing up. Just making sure her clothes are on her when we're not exposing anything for dignity. We're making sure everything's covered up. So I'd have Miss Allen put her hands around my waist. And then I would ask Miss Allen on a count of 3. I'm going to place my legs between hers. And then I'm going to bend and we're going to stand up on a count of 3. 1, 2, 3. So we're going to stand up. And I would ask Miss Allen, she's now touching the ground. And I say, Miss Allen, are you okay? Miss Allen tells me she's okay. So the next thing I'm going to tell Miss Allen is that we're going to pivot over to the chair. So we're going to pivot over on my right side and your left side. So we're going to pivot, 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 pivot. Miss Allen, do you feel the back of the chair? And at that time, I asked Miss Allen, does she feel the back of the chair? I'd ask her to put her hand on the back of the armrest. And then we would sit down. So I would tell her to sit down and I'm bending with her. So I'm bending to make sure that Miss Allen is in the chair. She's comfortable and she's safe in the chair. Now that Miss Allen is in the chair, I'm going to remove my gait belt. Okay, Miss Allen, can you lean forward just a little bit? Thank you. So now I'm removing Miss Allen's gait belt from around her waist. And then I'm going to give Miss Allen her call light. So I'm going to set that back on my barrier. Okay, Miss Allen, do you need anything? A magazine or anything like that? Miss Allen says she doesn't need anything, and I would give her her call light in her hand. I'll make sure her environment is together. I'm gonna make her bed back up. Everything will be nice and pleasantly together before I leave out of her room. So let's just say she's watching TV at the front. I would just make sure her bed is made, not leaving anything out of the way. Then I would go through my skills. I would go through everything in my skills. Did I knock on the door? I would put my gait belt up. And then I would ask, did I knock on the door? Let me put her gait belt up before I even do that. So I'm going to use this and I'm just going to put her gait belt right back where it was, so that once it's kind of transfer her back from the chair to the bed, it's there. So I'm going to go through all the steps of my skills in my head. Did I knock on the door? Did I announce myself? Did I let her know what I was doing? Did I check the bed for safety? Did I provide safety? Now I would do a correction because I didn't show you guys that I locked the wheelchair, but you want to make sure that the wheels are locked. So when I check the bed for safety, when I put the wheelchair in place, I lock the wheel. So you want to make sure that you're going over those steps in your head, saying I locked the wheels. The bed was in the lowest position. I dangled Miss Allen off the side of the bed. I stood her up straight. let her get her bearings. I didn't just transfer her. I wanted to make sure she wasn't dizzy. And then I had Miss Allen to pivot over to the chair till her legs reached the back of the chair. Once her legs reached the back, she put her hand on the armrest and then she sat down. I bent with her to make sure that she had a safe transfer. Now she's in her chair. I made sure Miss Allen had her call light. And now I did my hand hygiene. I put my supplies away. And now I can tell my proctor my skill is complete. Please like, subscribe, and share. I will be bringing videos to you on a regular basis on how to successfully pass headmaster's tests in the state of Michigan and maybe